Hello everyone, today we're having a very interesting topic. A lot of people have been coming and asking, had sexual intercourse during pregnancy and they had a miscarriage after. Was it the sex during pregnancy that led to a miscarriage? This is what we're going to be talking about. So, does sex during pregnancy cause miscarriages? Then this video is for you. Let's dive into it. This is Talk Pregnancy with Dr. Nuela, where we tell you all about pregnancy and other women-related health issues. If these are the kind of content you like to watch, don't forget to click on that subscription button. Okay, let's go. Now, you have to know that sexual intercourse during pregnancy, if you had any problem during pregnancy, then your doctor might recommend you not to have sexual intercourse. We're going to talk about that at the end of the video. But if you don't have any complications during your pregnancy, sexual intercourse is very safe during pregnancy. There are times that women say when they are pregnant, they don't have the desire to get to have intercourse, and they don't even discuss that with their partners. And then they say it tends to be like, oh, with pregnancy, this disturbing sexual intercourse. No, no, please. Let's see. There are also benefits of having sexual intercourse during pregnancy. It has a lot of benefits. We're going to see whether sexual intercourse causes miscarriage. Let's see. The uterus, and let me take again another demonstration. Now we're going to demonstrate from here. I hope we can see it clearly. This is a woman who is pregnant. This is a woman who is pregnant here. You see where the baby is. There's the amniotic fluid. This is the water where you see the water has burst. This is the water where the baby swims in. And this is the womb, which has muscles, a strong muscle which is present. Now, this one we can say the baby is big. This when maybe the baby is a little bit this when the baby is a little bit smaller. If you can see here, the baby is smaller here. So we see the muscles of the womb, and this is when sexual intercourse occurs. So this amniotic fluid and the muscles here are very strong, solid, in a way that protects the baby from being harmed during sexual intercourse. So the first thing is the sperm does not even reach the baby, and any problem, it does not reach the baby because the amniotic fluid is protecting the baby. Now, what happens during sexual intercourse? There is ejaculation, and this semen, it contains fluid, it contains chemicals called prostaglandins, which are present in the semen. And these prostaglandins cause uterine contractions. So it causes contractions of the womb. But most of the time, and sometimes it can lead to mild bleeding. So if this happens, most of the times you can feel some contractions. Even normally when you're not pregnant, when you have intercourse, you can feel some contractions like you are seeing your period or when you're on your period. So when this happens during pregnancy, these muscles protect the baby, and also the amniotic fluid acts like a shock absorber for this. So mainly, this should not cause any miscarriage. What is miscarriage? Miscarriage is what we call a spontaneous loss of a baby before viability. Viability means that the baby cannot survive out of the uterus. So it is a spontaneous loss of a baby before the baby is able to survive out of the uterus, or out of the womb, out of the mother. And in Cameroon is, or in Africa is usually assumed to is usually considered less than
28 weeks of
but
pregnancy.
in other Western countries, because they have more sophisticated machines to take care of very fragile babies, they consider it from 24 weeks to 20 weeks, depending on where you find yourself in. So any pregnancy loss below that week is considered a miscarriage. And there are many things that can cause miscarriages, but the most common cause of miscarriages is malformations. That's the babies are not formed well due to chromosomal abnormalities, and the babies actually die because they cannot survive even inside the womb. They cannot survive. So these ones are due to severe malformations that the baby just die and they lost and they come out. That's when miscarriages occur. So those are the most common causes of miscarriages. And secondly, is like infections as well, especially in African countries, urinary tract infections and malaria. That's why if you're pregnant and you have any fever or lower abdominal pains, you report immediately, because they have to check for all these, because this can lead to a miscarriage. Now it's also going to determine to as well, you have to determine to the position of intercourse that you have during intercourse, the positions you take. You can use any position to have intercourse. The position does not really matter. What matters is which position are you comfortable with. Once you're comfortable, if there's any position which you're uncomfortable with, you can change and try another method or another style. So any method of having intercourse during pregnancy is recommended. But as the pregnancy grows bigger, you'll definitely not be able to lie on your abdomen, or so there are different positions. All is in a bit, the one which you are comfortable with, you use that. Now sex is very, very beneficial, especially during, in general it's beneficial because it also increases your mood, it increases your contact with your partner, it creates bond between you and your partner as well. It brings back love among the family. And second, and most especially during the third trimester, that's 9 months. During 9 months, when you're close to your due date, intercourse is very, very important. If you can have it as frequent as possible, that will be fine, because with the release of these prostaglandins, remember, if you know this, the secret is the medications they usually use to cause like forced labor, to put forced labor if you have not yet gotten into labor, is usually these prostaglandins, which are manufactured and you are injected with bird, and you are giving it to stimulate labor. These things are naturally found in semen. So after ejaculation, prostaglandins are being sent, which can stimulate the cervix to start dilating and then provoking contraction. So it's very important during the last month of pregnancy. If you can increase your rate of having intercourse, that will be good for you. Now, it's when do you consider not having intercourse? Remember that if you have any doubt, let your health personnel decide if you should have intercourse or not. Please make sure you consult your health personnel. But there are other cases that you can know that you don't have to have intercourse during pregnancy. If you're having a vaginal bleeding, they'll always advise for bed rest, so you should not have intercourse. Bed rest is plus intercourse, no intercourse, so you should not have intercourse. If you're having an amniotic fluid leakage, if the water has burst and is coming out, you're advised not to have intercourse. If the placenta is said to be inserted down, what we call placenta previa, sometimes the placenta might not attach towards the side or up, but it can go and attach at the level of the cervix and close the cervix where the baby has to come in. So in that case, you are advised not to have intercourse. If it is even discovered early, you are advised not to have intercourse for the whole pregnancy, because if bleeding happens there, it's going to be massive. So once you discover that, it's always they advise you not to have intercourse. Now, if you also had a history of early labor, early deliveries, if you are someone who usually have your labor very early, and you have had a history of delivering babies before time prematurely, then you start have to also avoid intercourse. Then make sure you discuss this with your health personnel and have an open discussion with your partner. Now, there are people who might say, I don't even feel like having intercourse for the whole pregnancy. I'm so tired, um I'm so tired. I have nausea and vomiting. I don't feel like. Is that okay? Yes, it is very okay. But what do you have to do? Remember that you're not having intercourse just with yourself. You have intercourse with your partner. You need to create a loving environment to explain it and it should be an open discussion where both of you actually decide and say it in a loving way and an understanding way. But there are other ways that you can do if you don't even have intercourse, but the close contacts like cuddling and every other thing, you can do that, please. So it's all about discussion. So sexual intercourse, if you have a normal pregnancy, sexual intercourse should not cause a miscarriage. But if you're having intercourse and you have these contractions and bleeding, and these contractions starts increasing, don't fail to report immediately to the hospital. I hope this was helpful and you're going to give a thumbs up to our video and drop a comment on our comment section. If you want to also have a private discussion with me, then click on the link below and don't forget to subscribe. You're going to watch more of our videos. Thank you very much and God bless you.